I have the great pleasure now of being joined by the U.S. Surgeon General, Dr. Jerome Adams. Thank you so much for being here.
Thank you so much for having me.
And welcome and congratulations on your new title here. Let's talk about what your goals are in this role.
Well, one of the things that I'd like to do is to reframe the way we talk about health such that it resonates more so with voters and with decision makers. And what do I mean there? One of the things I'd like to do as Surgeon General is to put out a report on health and the economy. We know that voters and policymakers rank the economy and jobs as their number one priority. And I think if we can show them how investing in health ultimately will lead to a healthier bottom line, we will find a whole lot of willing partners.
I think we can strengthen the public health workforce to better promote health for individuals and really entire communities?
Well, I'm so glad you asked me that question. One of the things that I'm passionate about is showing the link between our nation's poor health and our nation's security. 71% of those 18 to 25-year-old aren't eligible for military service, largely because our folks are physically unfit. But what's interesting is we have an army, no pun intended, of folks throughout the country. We have National Guard units in every state. We have military units in every state. And if we can leverage those folks to get out in their communities and help folks be more active and be healthier, I think ultimately we'll have a safer society and a healthier society. The United States Public Health Service, which I'm proud to lead, has a PACE program, getting out into communities and trying to better engage communities and help them really get around the national prevention strategy. And if we can get other uniformed services to do that, I think we'll be in a better place.
Opioid use and misuse is truly a public health crisis in our country. What can we do to try to help?
Well, one of the things we need to do is really think outside the box and engage non-traditional partners. I was at the helm during the HIV outbreak in southern Indiana, the largest HIV outbreak related to prescription drug abuse in the history of the United States. And one of the things that I took from that is, yes, I needed to work with my traditional health and public health and medical partners, but I also needed to work with the faith-based community, with the local law enforcement community, with the business community. And by doing so, we were actually able to halt the transmission of disease and to connect over 200 folks to addiction and recovery support services. I think if we really try to bring in multiple different folks outside of our traditional silos to the table, we'll see that we can make better progress in terms of responding to this horrible epidemic.
APHA has been talking for years about trying to achieve this goal of being the healthiest nation. What do you think we need to do right now to work toward that goal?
Well, my mantra, as articulated at my swearing in, is better health through better partnerships. And one of the things that I challenge folks within the APHA and beyond to do is to think beyond your traditional partnerships. Think outside your silos. Make sure you're inviting, in particular, the business community, the law enforcement community, the educational community to the table when you have discussions about health. And don't just talk to them about the outcomes you care about. Speak to them about the outcomes that they care about. For instance, for the law enforcement community, show them how engaging in health will lower their recidivism rates. For the educational community, talk to them about how you can achieve higher grades and fewer behavioral problems if you have healthier students. I think there's a lot of opportunity there, and I challenge folks to think about those non-traditional partners the next time they're having a convening and make sure you invite them to the table.
How do you think the U.S. health system needs to change to achieve the goal of being the healthiest nation?
Well, I think we've certainly got to look upstream to prevention, and it's why I'm so happy to be here at this APHA meeting. We know that it's important for folks to have access to good quality medical care when they need it, but we know that as a country we are over-consuming it, and we're never going to solve the problem unless we move upstream. If we want to be the healthiest nation in a generation, then we really have to engage communities and put an environment around folks that leads to wellness instead of waiting for them to get sick and then focusing on health care and medical care on the back end.
U.S. Surgeon General Dr. Jerome Adams, thank you so much for being here.